Every year, millions of people receive healthcare treatment using sterile medical instruments in order to reduce the risk of transmitting diseases. But have you ever wondered how those sterile instruments remain sterile until they're used? This is achieved using sterile packaging. There are three main types of sterile packaging used to safely sterilize, store, and transport sterile items. In this video, we're going to look at rigid containers. The purpose of packaging reusable medical devices, or RMDs, is to provide physical protection while simultaneously allowing sterilizing agents to penetrate its barrier and sterilize its contents. Furthermore, the packaging is then used to safely store and transport the instruments until their use. This is one of many ways that healthcare providers can provide best practice in accordance with the relevant standards. The use of rigid containers must be permitted by the manufacturer's instructions. This will ensure compatibility with the sterilizing process. According to manufacturer's instructions, this Genesis rigid container is compatible with the use of saturated steam sterilization. There are multiple benefits to using rigid containers over alternatives. Rigid containers are robust and thus are not susceptible to tears or holes such as in wrapped or pouched instruments. The design of rigid containers is optimized for efficient handling. Furthermore, their design allows for efficient identification. It is essential that all rigid containers and the trays within them are carefully inspected to ensure that there are no factors that may compromise sterility. Such factors may arise from human error. Factors may also arise from compromised structural integrity of rigid containers or the trays within them. Now let's take a look at how to pack instruments inside a rigid container. Remember to perform hand hygiene before touching instruments. Remember to wipe the table down with alcohol disinfectant. Gently tap the container on the bench to remove any trapped debris. Remember to wipe the table afterwards. Insert chemical indicator. Insert checklist. Insert blue filter. Some rigid containers also require blue filters at the bottom, Fix the lid to the container. Ensure the handles of the container are in a suitable condition. Insert white arrows. Attach label to container. Before sterilizing rigid containers, it is essential that staff check for properly fixed labels, locked handles with fixed arrows, and a blue filter. If any one of these features is missing, it must not be sterilized. It should be sent back to be repacked. In summary, sterile packaging is necessary to sterilize instruments and then subsequently store and transport them until the time of their use. Successful packaging is that which matches the manufacturer's instructions as well as the standards of best practice. The standard of care we deliver to patients is of the utmost importance. For this reason, any error in the sterile packaging process must be identified as soon as possible and rectified by reprocessing. I hope this has given you an insight into the importance of sterile packaging and the significant role it plays in reducing the risk of transmitting disease.